What I am most hopeful about is that we will be able to work together to develop a system that is more cost effective, that does get more services to people, and not just more services, actually, the right kind of services, that with the state kind of moving aside and not being as involved in how these programs are run, that counties will have more flexibility to do what makes sense for the whole person. So if somebody needs human services, they can work with the county mental health department and they can blend funding if that makes sense. So I'm hopeful that the flexibility that realignment has given counties allows them to do what makes sense to provide better outcomes for the people that they're responsible for.
Hopeful that because we are moving into more integrated health era, that we will be able to better serve our folks whose physical health care needs have not always been well attended to, and share the burden with physical health care a little bit better, as far as system navigation and making sure that primary care physicians understand the multiple layers of care that our folks need. Obviously, I hope we survive as a specialty service. And I just hope that people really continue to go into serving our population, the public, acute and chronically mentally ill folks, as their passion, because it's such a rewarding field to go into. And for all of its challenges and all the resource issues, just being able to see somebody grow and move back into a community where they've been so alienated from for years and times, it's just so rewarding. And I just hope people continue to really go into that system.
That are actually kind of exciting. One is whenever there is a crisis in funding, oftentimes agencies are very open to seeing how they might work together. AB 109 with the prisoners returning to the community, I think, is providing such an opportunity. How can we work together in new ways to provide a service that the community really needs? And I think the whole idea of behavioral health partnering with primary care, it's not a new idea, but in Trinity County it's a new idea. And I think there's a lot we can do and that we need to do. So that's the second area. And then I think perhaps the biggest area for us might be the integration more fully of alcohol and other drug and mental health as a service that really works together to provide just the most basic interventions. So.
I think what I'm hopeful about is that we have kind of reached a tipping point, I think, in really identifying ways to improve our services, to identify outcomes better, but more importantly, those methods, we're gathering evidence that providing holistic integrated care can produce much better client outcomes, and that we can really be more resilient and we can reach better levels of wellness. And that's really what we're about, is how can people really move and progress towards a wellness that is acceptable to them and from their perspective.
Well, I think with health reform, I think there are potentials for us to really start to treat people as a whole and not to divide them up into what are their mental health needs, what are their health needs, what are their social services needs, but to really deal with the individual and provide them with sort of a full banquet of services that they can access, and to really
I'm hopeful that the concept of local control of decision-making can lead to more targeted
So anything you want to do,
community
use,
interventions,
he's available.
more individualized county treatment plans, so to speak, and implementation strategies that might be more cost-effective in the long run. So I'm worried about the transfer of responsibilities, but I'm also hopeful that it might lead to more efficiencies.
Is all that is necessary for evil to prevail is for good men to do nothing. And I think that, if you're not willing to get involved, then bad things are going to happen.